In the previous modules, we have discussed about the guidelines for intervention in children with ADHD. And we have covered that group intervention for parents, that we called also behavioral parent training, are recommended for children and for parents of young child with ADHD. But before taking a look at this intervention, we are going to discuss why this is so important to accompany parents of young children with ADHD. Of course, parents are the people who spend most of their time with their children, and we know that the way we interact with our children can significantly influence behavior and also emotional regulation strategies, both aspects that are already a challenge in some children with ADHD. So it's also important to note that parents with young children of ADHD report a significantly higher level of parental stress compared to the general population, but also compared to parents of children with other neurodevelopmental disorders. So it's also important to provide strategies that may help them to decrease this parental stress and increase their parental self-esteem. So in sum, it's easily understandable that a high level of parental stress can contribute to the development of dysfunctional interaction between a child and his parents, and that can create and trigger dysfunctional behaviors that are already challenging for a young child with ADHD. So we understand in that regard that intervention that can accompany parents to provide strategies and to decrease parental stress are crucial for parents of young children with ADHD. There are a lot of different programs that exist, but they share some common characteristics. Usually this program involves the parents and sometimes the children, but not always. And they usually have the same goals. The overall goal is really to prevent and also to deal with difficult behaviors in the daily life. So these programs typically use a combination of approaches. They can use some psychoeducational techniques to really understand why some problematic behaviors tend to emerge. There are also some communicative strategies that can be taught to parents to really encourage positive child and parent interaction. And they can be also they can use also strategies to reinforce positive and appropriate behaviors, such as the use of positive reinforcements. So in total, the overall goal of this program are really to reinforce positive behaviors while ignoring minor inappropriate behaviors and setting very clear and consistent rules for unacceptable behaviors. So as I was mentioning, there are different types of program, and some of them have been tested in the literature. We can name, for example, the Incredible Years program, or the New Forest Parenting program, or even the Triple P program. One of this program that we are going to discuss a little bit more in detail is the Triple P program that has received some support in the literature. So this Triple P program has been developed for parents of children between the age of 2 and 12 and is developed in different stages. So the first stage of the program is some sort of a universal program that can be applied to all the parents who are interested to learn more about behaviors of their children. And the level 4 and 5 of the program are more developed and targeted toward parents of children who have problematic or inappropriate behaviors in the daily life. In levels 4 and 5 of the program, there are a series of 4 individualized or group sessions with the parents, followed by 4 phone calls that can monitor the progress of the parents and the child. And the program focuses on different aspects. The first is really to promote a good and satisfying child and parent interaction in the daily life, and really to replace also the inappropriate behavior and to decrease the risk of violence that can happen among families when there is a children with ADHD. And the final goal is really also to increase the parental self-esteem and decrease the level of parental stress. So this is performed through the acquisition of 17 different skills, 10 that are used to promote appropriate behaviors in the daily life by, for example, learning how to positively reinforce the child after a positive behavior, and 7 skills that are used more to deal with inappropriate behaviors, such as the use of clear and consistent rules in daily life. And the program is really based to put the parents in practice through exercise and to really give them also homework at home so that they can generalize the skills that they have learned during the course. So are this program effective to reduce ADHD symptoms in young children? The answer seems to be yes. According to a recent review of the literature, these parental training tend to decrease the level of symptoms and to also decrease the level of challenging behaviors that can occur with the children. Interestingly, those programs also tend to increase the parental self-esteem, but they have shown no effect on reducing the level of parental stress. It's possible that the use of alternative techniques such as mindfulness could be useful to reduce the level of parental stress. It should be noted as well that there are not so many studies that compare the different programs between each other. So, for example, some studies have suggested that programs that were specifically targeting children with ADHD, such as the New Forest Parenting program, are not more effective on reducing ADHD symptoms compared to more general approaches such as the PPP program. And other studies have really found that the main component, what seems to be most useful in those programs, is the learning of techniques, of behavioral techniques such as the ABC technique, that really aims to focus on what comes before a challenging behavior, what we can do to prevent those behaviors, and also what we can do to positively reinforce appropriate behaviors. And that seems to be really a core element of this program. So in conclusion, we have discussed in this video why this is so important to accompany parents of young children with ADHD in order to give them strategies to deal with the inappropriate behaviors in daily life and also to reduce parental stress and increase parental self-esteem. And we have seen that such programs that target those abilities are really efficient to decrease ADHD symptoms and to increase self-esteem.